And with getting my nursing degree from Shenandoah, I knew that there were some perks going back to Shenandoah. I really liked Shenandoah, so it was kind of always my goal to end here or get my master's through Shenandoah.
I wasn't really sure that I wanted to be a psychiatric nurse until I actually got to my clinical. It was an inpatient unit for substance abuse, and then after seeing the therapeutic relationship between the patients and the nursing staff is when I realized I wanted to explore psychiatric nursing more.
I will be able to treat psychiatric patients, behavioral health patients, mental health patients in an outpatient or inpatient setting.
There are a lot of patients with mental health issues that can't afford to see a psychiatrist, that can't afford to go take care of that aspect. And as a psych NP, I will be more accessible to them.
This program goes straight from your associates to your master's. It's a bridge, and you take some bachelor's classes that you need to be bachelor's prepared, but you don't actually have to obtain your bachelor's degree. And you go straight to your master's. I was able to save a few classes in terms of saving more money and go straight to my master's.
You know, and we're looking at their mental vital signs, what we call how their sleep is, their appetite, their mood, their affect, their thought process. And then we go from there and base our treatment and care plan off of that.
The professors, I would say, is the best part of this program. They really help you along the way. They help you get set up with clinical sites, which is kind of rare in some programs that you have to set up your own clinical sites. So that I am forever grateful for, because they set you up with someone who knows where you're at in the program, who is very helpful as far as easing you in to see patients and helping you get to the goals that you want to.
I believe a lot of the hands-on training, especially the fact that a lot of our professors are experts themselves, it gives us more of an idea of what we will be experiencing once we graduate. The assignments, the clinical placements, I feel like definitely prepares you for what you're going to experience once you graduate.
And I think that is the main part of it, because we are hands-on, we see patients, and when we graduate, we're going to be doing the same thing. We're going to be doing either medication management with therapy, which is a key part of this program. So, and I believe by the time we are done in August, we will have been fully ready to take on the job.
It's suited for somebody who has a family, somebody who's already in the market but can't afford to go to school full-time. There's the option of doing the program fully, 100%, and the option of doing it part-time. I've met a few people that are taking one classes at a time. And what I like best about it is the fact that I don't have to go out and find preceptors and work hard to beg somebody to teach me, and that's already taken care of. That's the best part.
The professors here are very, very considerate because they know that we are adults now. We're working, we have families, so they understand that, and they can kind of change things around in the schedule classes. If if it's a big deal and they need to work with us, they do that.
I've spent the last 19 years working in psychiatry. It is my passion, and it gives me a different perspective on the treatment choices that my providers make, and it makes me aware of the treatment choices that I'll make when I'm done.
It's helping me a lot because as an older student and being able to do it online, we do meet once a week. That's very helpful because I do not have 5 days a week to be in a classroom. And being able to reach your professors through emails, and they're very accessible. One phone call away, I can get any of them. And so I like the way it is.